We know that dealing with a lung cancer diagnosis is, well, it's an incredibly tough journey. A huge first step is just trying to understand your treatment options. So that's what we're going to do here. Walk through the key information to hopefully bring a little bit of clarity to a really complex time.
You know, getting a lung cancer diagnosis it's overwhelming. It's completely normal to feel lost and wonder, okay, what happens now? Our goal here is to help make that process a little clearer, breaking down the steps and the different treatments you'll likely hear about. Okay, so the first thing to really get your head around is this. There is no one-size-fits-all approach here, not at all. Your treatment path is going to be completely unique to you. It's all based on the specific type of lung cancer you have, what stage it's at, and of course, your overall health.
And listen, you're not going to be figuring this out all by yourself. You'll have a whole team of specialists in your corner. We're talking about your main doctor, a lung specialist, a cancer specialist, your oncologist, surgeons, and even nutritionists and therapists. They all work together to build the best plan specifically for you.
All right, so let's start building that personal treatment plan. The first thing we need to do is look at the two main types of lung cancer, because honestly, the approach for each one is pretty different.
So lung cancer basically gets split into two main buckets. The first and most common is called non-small cell lung cancer, or NSCLC for short. The other one is small cell lung cancer, or SCLC. It's not as common, but it tends to grow a lot faster. And this big difference changes how doctors stage the cancer. For NSCLC, they use a pretty straightforward 1 to 4 system, but for SCLC, it's categorized differently, either as limited or extensive.
Okay, let's dive into that first type, non-small cell lung cancer. We're going to walk through this stage by stage because the treatment plan really depends on how far the cancer has progressed.
So, as we said, NSCLC is broken down into 4 stages. Think of this as our roadmap for the next few minutes. We'll start at stage 1, which is the earliest, and work our way up to stage 4, the most advanced, to see how the strategy changes.
All right, for the earliest stages, that's stage 1 and stage 2. Surgery is usually the main game plan. The goal is to get in there and remove the tumor. Now, the treatments for both stages are pretty similar, but with stage 2, your team might also recommend extra therapies, like chemo or radiation, just to be sure they get any cancer cells that might be left behind.
You're probably going to hear a lot of medical terms thrown around, so let's clear one up right now: lobectomy. It sounds complicated, but it's pretty simple. It just means the surgeon removes a lobe, which is just a section of your lung where the tumor is located. Now, by the time we get to stage 3, things get a bit more complex because the cancer has spread a little further. If surgery is still on the table, it's almost always followed by chemotherapy. But if surgery isn't a good option, then the focus shifts to a combination of things: chemotherapy, radiation therapy, and something called immunotherapy. So what is brachytherapy? Well, think of it like super targeted internal radiation. Instead of a big machine beaming radiation from the outside, doctors place these tiny radioactive seeds right inside or next to the tumor. It's a way to hit the cancer cells with a high dose while trying to spare the healthy tissue around it. It can be really helpful for relieving symptoms, like if a tumor is blocking an airway.
When NSCLC reaches stage 4, it means it is spread to other parts of the body. And it's really important to be clear here. At this stage, a cure isn't considered possible. But, and this is a huge but, treatment can be incredibly effective at slowing down the cancer, managing your symptoms, and really truly prolonging and improving your quality of life.
So because the cancer is now in different places, surgery usually isn't the right tool for the job in stage 4. Instead, the focus shifts to therapies that can treat your whole body. This means things like chemotherapy or immunotherapy, which helps your own immune system fight the cancer. There are also targeted therapies that can go after specific weaknesses in the cancer cells themselves. And this is where palliative care becomes an absolutely essential part of the plan.
Okay, let's switch gears and talk about that second main type, small cell lung cancer. And remember what we said earlier? The staging is different here. We're not talking stage 1 through 4. We're talking limited stage versus extensive stage.
Okay, so limited stage means the cancer is basically contained to one lung. The game plan here is pretty aggressive. Chemotherapy is usually the main weapon. Surgery, like a lobectomy, might also be an option. And radiation is used a lot, not just on the chest, but sometimes they'll use it on the brain as a preventative measure to stop the cancer from spreading there, since SCLC has a tendency to do that. Now, for the extensive stage, the cancer has spread more widely, maybe to the other lung or to other organs. Chemotherapy is still the foundation of the treatment, but it's often paired with immunotherapy. you might hear the term immune checkpoint inhibitor, or ICI. What that does is it basically takes the brakes off your immune system, letting it see and attack the cancer cells more effectively. Of course, radiation and palliative care are also a big part of managing symptoms here.
You know, we've mentioned palliative care a couple of times now, and it's so important that we really need to give it its own focus, because this is all about treating you as a whole person, not just treating the cancer.
There's a really common misconception out there that palliative care is just for the end of life. That's just not true. Think of it as an extra layer of support that you can get at any stage of a serious illness. The goal is simple: to make your quality of life better by helping you manage symptoms and stress.
And when we say palliative care, it's not just one thing. It's a whole support system. It covers everything from the physical side, like helping with pain or fatigue, to the emotional side, like stress and counseling. It can even help with the practical stuff, like navigating insurance costs or figuring out how to talk to your family about what's going on.
Okay, so we've talked a lot about medical treatments, but it's just as important to talk about what you can do to support your own well-being through all of this.
And just to put into perspective why all of this is so vital. Right now, lung cancer accounts for about 25%, a full quarter of all cancer deaths. That's a really sobering number.
And that number is exactly why understanding every single option you have is so critical. It's about empowering yourself with knowledge, because even though an early diagnosis always gives you the best odds, it's so important to remember that there are effective treatments available at every single stage.
And beyond the medical treatments, there are so many things you can do to support your own health. Simple things like light exercise, eating well, and getting enough rest. But also things for your mind, like doing hobbies you love, trying relaxation techniques, or just spending time with the people who lift you up. These aren't small things. They are powerful tools that can make a huge difference in how you feel, both physically and emotionally.
So, we want to leave you with a question to think about. What's the first thing you'll ask your care team? Because being an active part of your own care is one of the most important things you can do. Thinking about your questions before an appointment can help you feel more prepared, more in control. No question is too small. Thanks so much for joining us.